So different regions of the vertebrae. Now the cervical vertebrae, C1, which is called atlas, and C2 is called axis. They are a little bit different than other vertebrae. C1 does not have the vertebral body here. It has an anterior arch and it has a posterior one. It also has these articular facets, and they articulate with the occipital condyle of the occipital bone. You also have the transverse ligament here, which I will come back to the transverse ligament, okay? So the axis, this is the axis, and the C2, it has the vertebral body. And the vertebral body has this bony projection that's called dens of axis. So the dens of axis is located posterior to the anterior arch of C1. And also there is the transverse ligament that is located behind the dens. So these two, anterior arch and the transverse ligaments, prevents movement of the axis anterior, posterior like this. It prevents that. Because if it moves, then it can damage the spinal cord. So that's why it is there. And some people, for example, people with rheumatoid arthritis, that area can be damaged, and then they can have pain and may even have paralysis. So now the rest of the cervical vertebrae. So you can look at the body. The body is small. You can see the vertebral foramen, so almost similar to that. This is the body located anteriorly. This is the pedicle, and this is the lamina, the flat area. This is the lamina, and this is the transverse process. Okay, it's a transverse process here, and the costal process, which you may not see it in all cervical vertebrae. And in between you have this opening that is called the transverse foramen. This is the transverse foramen, and the content of the transverse foramen is vertebral artery. Vertebral artery. You also have the spinous process, but you can see the spinal process is split here, and this is called bifid tip. Bifid. And you can see that this the upper edge is oblique and the inferior edge is horizontal. So these are a few features of the cervical vertebrae. And if you look at the thoracic vertebrae, they look like a giraffe. Do you guys like giraffe? I think it's a magnificent animal. I'm a little bit jealous of it because it is a little bit taller than me, but not much. Okay, so vertebral body located anteriorly. Okay, vertebral body contains specific articular facets here. This is called the superior costal facet. This inferior costal facet. Superior one, it articulates with the head of the superior rib. Okay, and the inferior one articulates with the head of the inferior rib. And this is the transverse process. This is the transverse process, and that also contains an articular facet. It's called transverse costal facet. This one and this one and this one, and this articulates with the tubercle of the superior rib. So superior rib, the head starts here. Then is the neck area that does not articulate with the vertebra, and then is the tubercle, and then the ribs comes like that anteriorly like this. I will show this to you later once again. The vertebral foramen is now less than the vertebral body because there's more weight on the thoracic cavity, and because of that there's more pressure on the thoracic vertebrae. And look at the spinous process. Okay, so it's totally oblique and it's not bifid, so it's not split here. This is the lumbar vertebrae. It looks like a moose. You guys like moose? Okay, I hope you do. So here is the vertebral body, so big compared with the vertebral foramen. Why is that big? because there's a lot of weight on the lumbar area. That's why it's so big. This is the pedicle. Okay, this is the pedicle, and this is the lamina, flat area. This is the lamina. It has the transverse processes, but does not have the costal facets. The body does not have the costal facets either. There's nothing there. There's no ribs here. Superior and inferior processes are there. Okay, superior and inferior processes are there. Look at the spinous process. Okay, it is horizontal, it is thick, and it is short.